Hello friends. Now let us look at the next video of MCQ for you, next MCQ in our series MCQ for you. I'm Dr. Amit Desai. I'm a surgeon and I take lectures for NEET PG as well as for FMG. So let us take this question. A patient was admitted with complaints of ureteric stone, ureteric calculi. All right. He was on treatment with IV fluids and analgesics. Suddenly, he developed a radiating pain to the pubic area and medial aspect of the thigh. The stone is coming down. What is the most probable site of lodgement of this stone? Okay, so they have given us options, whether it is at the renal pelvis, whether it is at the pelvic brim, whether it is at the level of gonadal vessels, or whether it is at the intramural portion of the ureter. So now let us see three places where the ureteric calculus can get impacted. Okay, ureteric calculus can get impacted. There are three places, all right? Let us look at these three. Now, before we look at these three, let us see how the ureter is formed. So, embryologically, when the ureter is formed, what happens is that it starts off like a rod. That means there are cells everywhere. Okay, if you see, there are cells everywhere. Okay, this entire ureter is full of cells. All right, it is full of cells. Okay, so it is like a pillar. If you cut a pillar, there will be bricks even inside. So similarly, this is how it is. Then what happens is that then a cavity develops right in the middle. All right. So there are cells everywhere. There are cells everywhere all over. And a cavity develops in the middle. And this cavity extends in all directions. Okay. Craniocaudally and even on the sides. And as a result of which, what happens is that this ureter becomes canalized. So what was earlier like a pillar has now become something like a straw. Okay, it has become canalized. So it has become canalized like this. All right. This is how the ureter forms. Now remember, the cavity appears initially in the middle and it extends to both directions. That is why the two ends of the ureter are the ones which get canalized the last, and these are the areas which are likely to be slightly narrow. So two ends of the ureter. Which are the two ends of the ureter? So one, of course, is at the renal pelvis. Okay, that is pelviureteric junction. And the other is its junction with the urinary bladder. Okay, so urinary bladder, that is the intramural portion. Okay, that is the intramural portion, or better still, let us call it as vesico-ureteric junction. The third place where it is likely to get caught is at the pelvic brim. At the pelvic brim. Now, if it gets caught over here, there'll be stretching of the renal capsule, and usually there will be flank pain. Okay, flank pain. There might also be nausea, vomiting. All right. In vesico-ureteric junction, what happens is by this time the splanchnic nerves are involved, and as a result of which, what will happen is there will be frequency of urination. All right. There will be dysuria and other lower urinary tract symptoms. All right. Hesitancy. All these things will also be there. And it is at this pelvic brim that the pain will radiate to the pubic area and medial portion of the thigh. So our answer over here is the pelvic brim. Okay, our answer over here is the pelvic brim. Now, why it is at pelvic brim? Because that is the place where the ureter turns slightly posteriorly. Okay, and that is why there is a small kink over there, and that is the reason why there can be the stone can get lodged over there. All right, so these are the three important places where the stone can get lodged in a ureter. All right. So if you've liked this video, please subscribe to our channel, ADSL Academics. Please hit the like button. Please also press the bell icon so that you get notification for all our new videos in the future. Okay. Thank you very much.